Hello everyone, this is the SD Times Healthcare Handbook. Here's Editor-in-Chief David Rubenstein to tell you more.
Hello everyone, I'm Dave Rubenstein and this is the SD Times Healthcare Handbook. We've created this handbook to dive into how technology is changing the delivery of health services and the access to massive amounts of medical records and other data that improve patient outcomes. With me is Bob Stanley. He's the Senior Director for Special Projects at data quality company Melissa. So Bob, why don't we just get right into it? Well, hi, Bob. Thanks for being with us here today. So we know Melissa is known for solutions that help organizations validate data that they have. And I know you have other tools that can kind of access public data repositories to fill in gaps in some data that may be missing. So maybe you can talk about the kinds of solutions and tools that you bring to organizations to help them ensure that their quality, their data is of good quality.
Right. Thanks, David. It's really nice to be here, and thanks for inviting me, and thanks for inviting Melissa. And a lot of people a lot of people do know Melissa Data as the data quality source for particularly contact data, customer information, and that sort of thing. But what a lot of people don't realize is Melissa Data also offers data quality solutions in e-commerce and CRM, as well as really targeted for Microsoft and Oracle environments, SaaS data cleaning, SaaS data cleaning, you name it. So there's a lot of breadth inside and depth inside what types of data Melissa can help you work with. We're really proud of one of our newer tools, which is called the Unison environment. This allows for end users to create data quality workflows themselves from a web-based framework. We're also really proud of what we call our Smart Sharp API-based data quality resources, and that's tying into some of the things you mentioned earlier on. That will be calling back to gold standard data sets, where we'll integrate maybe 3 or 4 recognized quality data sets and come up with a standard. We can compare then for example, your e-commerce customer list or your marketing customer list to that gold standard using these Smart Sharp APIs that we can create in Unison. So that's just a little bit of a sort of introduction to some of the things we're doing and some of the newer technologies. And then also really proud of our ability to work with more advanced data quality challenges in other fields like healthcare, environmental science, and that sort of space. Yep.
So how specifically do you tailor your solution for healthcare? What kinds of data are they looking at, and what kind of problems are you seeing that healthcare organizations are having with their data?
Right. And this is also an area kind of where I think Melissa brings some really smart solutions, having done a lot of high volume, really dynamic environment data quality work in the contact space. We're able to kind of bring a much more efficient way of working with data quality in healthcare than what's coming up out of the pharma space. We're sort of coming in from big scale data quality in big markets and moving into the healthcare space with these efficient solutions, calling these Smart Sharp APIs and things like that. So we're bringing in a little bit more of an efficient way of doing things rather than these big monolithic data warehousing or data lake methods that people have been trying to use for the last few years in healthcare. Mm-hmm. But there are a lot of challenges in the space, particularly with data coming from what they call real world evidence, hospital systems, electronic medical record systems, and things like that, where you can have, in fact, we had a customer example where there were over 190 different ways that the same medication was referenced from within a single EMR system. Wow. Right? So you'll run into those kind of challenges. Mm-hmm. And then in a way that's very similar to the strategy Melissa applies to e-commerce and geo and contact data, we also will be calling to master reference data sets, right? Using these API calls. So we'll use, just for example, this is where we may get a little bit more custom, but we have our sort of out of the box data quality solutions using, for example, FDA's UMLS, right, as a really authoritative standard. We might work with other data formats or standards like coming from NCBI or SwissPro, SNOMED, MESH, you name it, medical subject headings, those kind of information. We're actually really excited about a standard called FIRE, FIHR, that's coming out. That's really helping us a lot with our electronic medical records data harmonization. And so whether we're looking at drug data quality, genetic information, proteomic information, outcomes, what diseases is this actually the disease we're expecting to be seeing for that patient, as well as something that's super important that Melissa brings in that's a little bit rare. Patient identification is incredibly important, right? So that's a really sort of a strange challenge where you might have a lot of things that are similar, same zip code, same first and last name, even same age, right? For patients in big hospital systems. And so you really need to be able to do a better job with patient identification and know you've got the right patient that you're connecting the drug treatment information to. And with Melissa's data's pretty much best out there, contact and patient information verification, we could do a fantastic job with patient identification, which is a big challenge in the space. I hope that's trying to give you a quick overview there. Hope that's useful.
Yeah, no, absolutely. So we're talking about big data, huge amounts of data where you look at it again from patient identification as well as drug verification and hospital verification, a lot of these other types of things. And I know FIRE is one of the standards that people talk to. So is this an automated deal? Like every time a piece of data comes in, it immediately gets assessed by your solution, and then you go to solve the problems, or it all gets input first and then somebody has to trigger something, or how does it work exactly?
Right. And that's a great question too. And that depends on the customer need, basically. So we have a lovely example of a group we're working with called Tigo Health. They're connecting to several hospital information systems. They need to get all the data pulled out of these different Cerner and eClinicalWorks and other electronic medical record systems. And then that needs to be harmonized. And then it needs to be delivered to mobile applications for first responders to see whether or not that person has allergies or whatever they may need to know, right? And that's requiring an automated frequent update, right? That'll be refreshing the data frequently. And I'm really pleased to be working with a team here at Melissa that has a lot of experience with what they call health information exchanges, big McKesson work and things like that. So we're very familiar with the requirements of big scale. And, depending on the specific environment, we may work with an existing like HIE that will help us a lot with scale. With the particular customer I was mentioning, Tigo, we're working with a group called Redox that will help us with that. And then we'll have a big server in the background, just running through the update and data quality process, right? So that's an example, which is automated and 24/7 and delivers data near real-time updates. But then there are other examples that are also really nice. We have some publications on some of these, like if there's a company, let's just say AstraZeneca's had a big history of clinical trials, and they've got a lot of different clinical trials data in different directories kind of sprinkled around the labs, but they want to bring that together and try to really use that clinical trials data to understand what's happening with one of their drugs that maybe wasn't so obvious from the specific trial, right? So they want to do a retrospective study on a big group of clinical trials. That might be a one-off, creating a research data set from a lot of kind of messy hospital data that's come in that was underutilized. They got the submission to the FDA, but that's all they got, right? And so we'll come and do things like retrospective studies where we'll create new data pools that may be useful for research, things like that. Yeah.
Wow. So we know the coronavirus has kind of changed or maybe accelerated the way the medical field has to digitalize itself. And so we have now more telehealth kind of things. We have more remote services. So as far as the role for developers in this digitalization, this transformation of the health industry, how important is it for them to know when they're creating, let's say, a mobile app that somebody can use to transfer this data, that the data that they're getting is accurate? And is it their role in any way to ensure that that data is accurate that's going into their applications?
Yeah, so that's actually a really interesting area, which is kind of where is the QC? Is that in a sense what I'm hearing you?
Sure.
Yeah, and so that depends on a number of different steps. At the end of the day, it's really the person delivering the application and the data is going to have the responsibility, right? In other words, you're my customer. You're purchasing access to my product, right? And we're often partnering with others who will be delivering that data, right? Then we have to have a really clear relationship with that person. We have to do a number of different data quality analyses. We may even use a little bit of the machine learning and machine reasoning to kind of look at data quality and see if we're getting what we expect out of the back. And depending on the expectations of the application, that may be more or less rigorous. The requirements may be more or less rigorous. So if we're going to be supporting a research study that's going to be directly impacting care, then you're going to need to have a really tight analysis, and you could probably need to do a statistical analysis of data quality, right, to make sure that's clear. If you're just taking recognized patient names and IDs from a single electronic medical record system, putting into a database and delivering it to a third-party app, data quality is also really important there, but you may not need to do quite such extensive testing, right? Because it's just a straight pass-through. You need to know that you do need to do testing still. You need to do input and output comparison testing and make sure you know what you're getting. And often that's what people will hire an informatics group to do, like the Melissa Informatics group, to sort of ensure the data quality. But at the end of the day, though, it's whoever's delivering the data to the customer that's going to be, sort of on the hook. But we're going to be on the hook to that customer, if that makes any sense.
Okay, Bob Stanley, Senior Director for Special Projects at Melissa. Thank you so much for joining us today. It's a great conversation.
Thanks a lot, David. It was a lot of fun. Really enjoyed your questions.
Thanks. And to everybody who's listening, thanks for listening in. And once again, I'm Dave Rubenstein, Editor-in-Chief of SD Times. So long for now.
Thanks. Bye.